Hi, did you guys just see that? That's me practicing for my Myrtle Beach golf holiday. I'm going to be there when you guys see this YouTube. And sorry, but not really that sorry that I can't be there with you guys today, but I am in my office this afternoon and I'm going to get 10 of my best tips for the COPD and the heart failure module to share with you guys. And we have my two daughters who are helping us. Thank you. Hi, our first tip is how to use the COPD-6 in the flow of a normal office and to use it quickly and efficiently. So it's important to have all your stuff close at hand. I keep mine on the desktop computer under here. I grab it, I have my peak flow meter pipes under the sink, and I'll attach one to the COPD-6 meter. It's also have the printer ready and the pen to write the name. So the first thing we do is attach the pipe, and it's fitting snugly. If this does not fit snugly, you can use a little bit of micropore tape along the inside rim, and that will make this simple piece of cardboard pipe fit better. So we'll turn the machine on. It defaults to 50, and I've got my patient here, Andrea. How old are you, Andrea?
14.
So I'm just going to bring this down to age 14, which is a lot of pressing because it defaults to 50. Okay, once I have it at 14, I hit enter and it defaults to the next setting. How tall are you, Andrea?
I'm 5'4".
So 64 inches. Put in enter, it defaults to a woman or a lady, and white Caucasian. So we are ready to go. Andrea, I want you to hold this with your hand, fill your lungs up with as much air as possible, put your lips and teeth around the pipe and blow hard when I tell you, and keep blowing for 6 seconds. Okay, you ready?
Mm-hmm.
So fill your lungs up with as much air as you can, lips and teeth around the pipe, and blast off. Keep going 2, keep going 3, keep going 4, keep going 5, keep going 6. Good, and I'll have a quick look to see if it's valid. It is a valid blow, so we get ready and we're going to do the same thing all over again. So take a big breath, and lips and teeth around it, and blast off. Keep going, don't stop, keep going, oh, took a second to roll there, Andrea. So that won't be a good one. So we'll use a third one, okay? So fill your lungs up. Big breath, lips and teeth around the pipe, and blast off. Keep going, don't take another breath. Keep going. There we go, perfect. So we got 3 good readings. I'll dispose of the pipe right away, and now we're going to connect the COPD-6 to our computer, and we'll just bring up our software here, and we'll press the start button for the software. It has not, now it is connecting, trying to connect with the device. Sometimes this happens, so I'll unplug it and plug it in again sometimes just to get it to recognize. And it'll tell us down here now it's connecting. Actually, I won't connect until I send the information over there. Hold on. Yes, now it's connecting to our data is transferring here. And I'll put the name in, Egan, first name Andrea, and Andrea's 94 pounds, I think. And we'll put your name on this here, defaults. And that'll bring my printer up here, and just going to print this out. It's called Dr. Egan's lung test. You can some of the menus you can alter that to customize it to your own. And we have a report. When the report comes out, I write on it right away. sign my name on it and date it. November 19th or 16th, 2014. So, lung age 11. Wow, and you're 14, Andrea. And your obstructive index is 88, normal, not COPD. Really good report. I like this. So if you were a smoker, let's just pretend that you smoke. Dad's shocked, but maybe he's found out you smoked like 10 cigarettes a day, you know, and we want to do an intervention. So we'll do S, T, A, or T. S is for setting a date. Any date you'd like to set? Today?
Sure.
Okay, so we put today. And who would you tell if you were a smoker and you were going to stop for support?
You.
Okay, Dad. What about Mom?
Also Mom.
And Mom, okay. And
Sister.
what would you avoid doing? A is for avoid.
I would avoid smoking.
Smoking and other smokers, I guess.
Mm-hmm.
And if you relapsed or if your plan didn't work, that's the R. You might set another date. And if you were to take something, could be willpower, or it could be nicotine gum or something. So take willpower. Okay. Our gum. Okay. There we go. Cut. My third tip is, how do you actually explain to a patient what COPD is? We have a patient here, Carly, my daughter. Carly, do you know what COPD is?
No.
Can you have a guess? What's your best guess? It's an acronym, COPD.
I don't know, something to do with lungs or something? I don't know.
Yes, most people actually don't know. Would you be shocked if I told you it's the 4th leading cause of death in North America and will be the 3rd leading cause pretty shortly above cancer? And hardly anybody actually knows what COPD is. Well, what this tip is a way to explain it to your patients. It is an acronym for chronic obstructive pulmonary disease, which means it can be a little bit of asthma, a little bit of bronchitis, and a little bit of emphysema. So I draw 3 circles, and in the intersection of the 3 circles here, one circle is for asthma, one circle is for chronic bronchitis, one circle is for emphysema. And where they all intersect is COPD. It's a mixture. It's a mixture of 3 diseases: asthma, bronchitis, and emphysema. And I have a little diagram to show that. Also a picture of COPD lungs, just to emphasize what it looks like. My 4th tip is to show you how to use UpToDate in the COPD module and how to use it as a resource for managing COPD patients. First of all, what I would suggest is you find your Victoria Divisions of Family Practice on Google, open it up and go to your members portal. And in the members portal, you'll have your passwords. I already have my passwords in there. Go to UpToDate. When you get to your UpToDate icon here, go in your Google Chrome to the menu bar and go down to More Tools. In More Tools, it says here, Create Application Shortcuts. When you do that, it will put it on your desktop and your Start menu if you want it, or the Quick Launch Bar. Just say Create and it's there, it's done. So when you want to use UpToDate, you already have it up here. It gives you quick access, 2 clicks, to be able to find whatever it is you're looking for. In this case, it's going to be COPD patient information. So put in COPD, it'll direct me to the UpToDate website, and I'll go to the patient side here, patient option. It has basics for the basic information on COPD and COPD treatment. It has in basics, and then for somebody who wants more detailed information, you have beyond the basics. So I've actually already printed out the basic up-to-date information, and it gives a really simplistic, probably grade 10 level explanation what COPD is, why did I get it, what are the symptoms, is there a test for COPD, a little bit about stop smoking and how is COPD best treated. And it's a 2-pager, and there's my tip, go use it. If you are using it, you do get CME credits up to 12 hours of Event Pro, 1 credits. I've got 2.5, and if you want to actually get them, you can log in with your password, fill out a little questionnaire, and you'll get credits for actually doing up-to-date work. Cut. My next tip is when you do a COPD-6 assessment on someone and you get a positive result, what do you do with that positive result? Well, it has a sensitivity, positive predictive value of only about 65%. The COPD-6 has a negative predictive value of about 95%, so it's really good at diagnosing somebody who doesn't have COPD, but not so great at diagnosing somebody who may have it. If you do get a positive result, it is recommended that you refer them for pulmonary function testing, and I would recommend having your form close to your COPD-6 machine in case you have to use it. And if there is no other good reason to order a full test, I would recommend doing spirometry, simple spirometry, volume loops with bronchodilator, because that waiting list is only 4 to 6 weeks. Whereas if you ask for a full complete pulmonary function test, that's about a 3-month wait. If you do get a restrictive pattern, that's a low FEV1 and a low FVC on your COPD-6 monitor, and you suspect more serious lung disease, my second tip is to refer that person to a respirologist for an evaluation, or to ask for a complete pulmonary function test, or maybe both. My next tip is about medication adherence. About 40% of people in North America are non-adherent with their medication, and this is very important as it applies to COPD and heart failure. The 2 tools I'd like to recommend are the Moriski tool and the mini-cog assessment for cognition. The Moriski tool has 4 questions. First question is, are you ever forgetful about taking your medication? And that's the most important question. Second question is, are you careful about how you store and use your medication? The third question is, do you ever not take your medication when you're feeling well? And the last question is, do you ever not take your medication when you're feeling unwell? The mini-cog test is another validated screening tool for cognition, and it has 2 parts. The first is you give them 3 items to remember. For example, penny, train, blue. Then you ask them to draw a clock showing the time 10 minutes after 11. If they can remember the 3 items after they draw the clock, they pass the test. If they can only remember 2 items and the clock looks well, they pass the test. If they can't remember 1 or no item on the 3 items, they fail the test and they have cognition impairment.
Sorry, I missed it. Oh no. Oh well. I'm feeling great today. I don't need these. Oh, I feel so bad. I don't think these are helping me.
My next tip is to illustrate how to use PowerChart and IntelliViewer in your office. I think it's a great tool, and if you don't already have it, it's easy to get. There are 3 steps involved in getting it. First, you need a passcode to log on. So you phone the IT department at the Royal Jubilee Hospital and tell them you want to get logged on to PowerChart. They'll issue you with a user ID and a password, and then you have to go and use the remote access login address, and I'm going to show you where to get that. It's on Google, so the remote.viha.ca is the address. Then this is the Citrix. You have to go to the Citrix website and download the Citrix software, and you install it once, and then you're ready to go. And once you're up and running, you can get logged on to PowerChart, which I will log on here, and get all the information that you need for your looking up your patient's charts and finding out when they're in the hospital and the contacts. When you're on the main page, you also have access to UpToDate, and you have access to another medical database called Dynamed and PharmaNet Viewer. And the other useful piece of software that's also in the network is your IntelliViewer, which is located here in your taskbar. And when you bring it up, you actually have the private clinics in town, and you have the primary access. And you can look up x-rays and use those in your office to discuss with patients. I have a couple of little stories to share with you guys to illustrate how important and how useful the IntelliViewer can be in your office. First story happened in the last 3 months. I had a 72-year-old man whose name is Robert, who presented with shortness of breath, and we worked him up and found he had a lung tumor. And he is a heavy 2-pack-a-day smoker, and when we worked him up, his PET scan indicated that it was a primary lung tumor without evidence of metastasis, so he could do well with surgery. However, he himself did not agree to the surgery and didn't think that he wanted to go through all of that, despite the best of my encouragement. So we didn't know what to do, so we gave him some time to think about it, and he still didn't want to go ahead with the surgery. And later on, I asked him one day if he'd like to see his lung tumor, and he said he really would. And I brought it up on IntelliViewer, and we have a picture of his lung cancer here from the IntelliViewer, which showed a mass in the left mid-lung area, as you can see there. And he had in his pocket a USB stick, so we downloaded the image by taking a photograph of it and put it on his USB stick. He went home, discussed it with his wife, and that was the difference that made him feel he actually could see it and he could understand it better, and he went for the surgery. And in fact, he is now recovering from a surgery in hospital, and he's doing well. And I don't think if we didn't go that extra yard with the showing him the x-rays that he would have went. Second interesting case is I did have a 58-year-old man who noticed that he was short of breath on his regular 2-mile walk. And he used to time his 2-mile walk, and he always did his 2-mile walk in a certain time. However, over the last few years, his time increased, and he was now 5 to 10 minutes longer at doing it than he was used to, despite him being fit and healthy and well in every other way. So I did a COPD-6 assessment on him and found that his FEV1 and his FVC were both very low, giving him a restricted pattern, which can have a lot of serious lung causes. So we were thinking of sending him off for a full pulmonary function test. But before we did that, I decided to look up and see if he had any x-rays on file, and he did. And I'm going to show you the x-ray he has on file in the next slide here. And this is the x-ray that we showed, and just small that down a little bit. So when we looked at that, you can see from the x-ray that his left hemidiaphragm is quite elevated, and he has a paralyzed left phrenic nerve. And when we went back in the archives, we found that this was present actually 10 years previously, and he does describe having had a pneumonia 10 or 15 years ago, and this is the reason for his restrictive pattern on his COPD-6. So he was relieved, I was relieved, and it prevented us the need to send him for full pulmonary function testing. And they're my stories. I have 3 quick little slides on heart failure. I'm by no means the heart failure expert. Dr. Swiggin will be giving us a really detailed overview of it, but I'd like to introduce a few concepts before we get started. I'd like to give the analogy of dealing with heart failure is like climbing Mount Everest. It's a long, hard journey, and the going can get really tough at times, and we just have to adjust it and keep our momentum up and keep going. Our overall concept is it is going to be a long journey, and we need to go slow. The treatment strategies, we look for and treat all underlying causes where possible. Faulty valves, coronary artery disease, high blood pressure, cardiomyopathies, thyroid disease, blood pressure disease, diabetes, and kidney disease. We educate, assess, monitor, make adjustments, and keep going. That's our job as GPs. We institute routines like doing daily weight, adherence to medication, as we've already spoken about. We check their ankles, we check their salt intake, keeping it less than 2 grams a day, appropriate fluid restriction. We balance rest and exercise, and eliminate and reduce what I call the SAS, smoking, alcohol, and stress. This is our heart failure action plan, and we have action plans on file that we can use and distribute to our patients. And lastly, the medications. We have a whole compendium of drugs that we use. Beta blockers are the mainstay, and the concept with the beta blockers is to start low, go slow, and aim high. In fact, as high as you can get. And the research shows that the higher the dose you get with metoprolol, carvedilol, and bisoprolol, the better the outcomes. With diuretics, they're great rescuers, and we use when they're fluid overloaded, and then we try and reduce the dose, and if possible, get them off the diuretics. Statins, ACEs, and anticoagulants like aspirin all have proven benefit as well. And thank you for watching. That is our slideshow.